International and the Kenya Medical Practitioners, Pharmacists and Dentists Union want the government to urgently introduce a supplementary budget of 10 billion shillings to purchase and distribute the COVID-19 vaccine to the entire adult population by the year January 2022. During a national health conference held in Nairobi, health stakeholders called on the government to ensure equitable distribution of COVID-19 vaccines and ensure treatment is free in government hospitals to avoid the risk of further infection as the country draws close to the general election.
With only 3.1% of country's total population fully immunized against the COVID-19 disease, stakeholders in the health sector have raised concerns over the distribution of vaccines in the country.
The biggest threat to the return to public health and the right to health is vaccine inequities, whether it be global vaccine apartheid, the reality that the rich nations have hoarded 70% or a large percentage of the world's vaccines and left very few for those of us in the global south, or it is within Kenya where we are seeing, for example, a high concentration of vaccination in Nairobi, but much less in the rest of the counties. This inequity is probably the most dangerous thing that we must confront at this point.
During a national health conference held in Nairobi, human rights organization Amnesty International and the Kenya Medical Practitioners, Pharmacists and Dentists Union called for more distribution of the COVID-19 vaccines across the country to avoid the risk of further infection.
The people that we expect to have information about the vaccine have not been adequately trained, have not been given adequate information to dispel some of the myths that are going around concerning this vaccine.
The stakeholders also called on the government to urgently fund local research and pharmaceutical companies to manufacture not only the COVID-19 vaccine, but also other vaccines necessary for disease prevention.
Whether they have the equipment, the human resource that is required, whether they have the commodities, is another subject altogether, which they are not really focusing on.
Stakeholders further called on the national government through the Treasury to take steps to ensure at least 15% of the national budget is allocated to health.
Our position has always been that health care is a fundamental right for every Kenyan. That means that every Kenyan should be able to access affordable and quality health care, especially from public health facilities.
Ben Chumba, Lunchtime News.